This is Dr. Robert Mahalich from Advanced Orthopedic Specialists in Brighton, Michigan. I would like to present some of the latest information about ankle arthritis and total ankle replacement. Ankle arthritis affects many patients in the United States and the world. It is less common than hip or knee arthritis. Most patients with ankle arthritis have had some type of injury in the past or a history of repeated injuries, which can be seen with sprains. In general, patients will experience pain with activity and have more relief with rest. The symptoms tend to be progressive over a long period of time. There may be swelling and progressive loss of motion and function. When patients seek the advice of a physician, evaluation is by history, examination, and x-rays. A CT scan is sometimes ordered by a specialist for better evaluation of the subtalar joint, which is below the ankle joint and not always well seen with x-rays. MRI is typically not helpful with the evaluation of ankle arthritis. Non-operative treatment should first be tried and can consist of medication, physical therapy, and bracing. Changes in shoe wear can be helpful as well. Injections with cortisone in the ankle joint by an experienced doctor can provide significant but usually temporary relief. The length of relief can be unpredictable, lasting anywhere from a couple of weeks to several months. Repeated injections with cortisone over a short period of time can be damaging to the joint and should be avoided. Once surgery is decided upon, there are several options depending on the patient's severity of arthritis, medical history, age, and functional goals. Sometimes a debridement or cleanup type procedure can be performed. This is best for patients who have arthritis that causes spurring to occur in the front of the joint. The advantage is that there is very little downtime and no mobilization needed after this procedure. The disadvantage is that it does not permanently address the problem. Ankle fusion is the time-tested solution for ankle arthritis. When the two bones of the joint are fused together, the pain from arthritis in the ankle is eliminated. The other joints of the foot can accommodate for the loss of motion of the ankle, and most patients will not have a noticeable limp. After fusion, patients can do many activities and can be a better choice for someone who needs to do manual labor. It is also sometimes the best choice for patients with severe deformities, significant subtalar arthritis, and multiple medical problems that would make a total ankle replacement more risky. For these patients, a fusion rod is the most stable way to provide a functional and less painful limb. A total ankle replacement is another option for the treatment of ankle arthritis. Total ankle replacement has been around for many years, but has recently gained attention due to the FDA approval of several ankle replacements that were designed to improve upon the previous generations of ankle replacements. Patient selection is important to the success of a total ankle replacement. Patients with severe deformities, bone loss, or previous infections are usually not candidates for replacement. Patients with diabetes, smokers, and rheumatoid arthritis patients are at increased risk of complications with this procedure. The surgery will require an overnight stay in the hospital. Most patients leave after 1 day. The total time for surgery is usually 1.5 to 2 hours under general or spinal anesthetic. Patients will receive a nerve block as well for postoperative pain control. Patients are required to be non-weight-bearing for 4 to 6 weeks to allow for healing of the incision and the bone around the implant. Some form of immobilization will be required for 6 to 8 weeks. Patients usually progress every 2 weeks from a temporary cast to a fiberglass cast to a removable boot over that time. Total recovery time is 3 to 6 months. Physical therapy is an important part of the recovery and usually starts at 6 weeks after the surgery. Once recovered, patients should be expected to return to most non-impact activities such as walking, golf, and skiing. Running is usually not possible or advised as it could lead to a more rapid wearing out of the prosthesis. Current studies demonstrate pain relief and restoration of function approaching that of or equal to a fusion. The biggest question facing total ankle replacements is durability. Currently, we expect a prosthesis to last at least 10 to 15 years. Studies are ongoing and show promising results. Thank you for your interest, and for more information or to make an appointment, you may access our website at www.advancedortho.net.